Happy Friday, everybody. It's Tammy Epps, the Director of Media Relations here at Prisma Health. Y'all all know me. So I am glad to be here with you today on Friday. And, flu is hitting us hard. Dr. Burch says she's working hard, and we know that she is as an infectious disease physician. Flu is hitting us hard. And then we have all the other things that are happening: COVID, RSV, strep, colds, symptoms overlapping, just a whole bunch of stuff. So we understand that quick evaluation is critical for early treatment and preventing complications. So today we have Dr. Anna-Kathryn Burch, who is a pediatric infectious disease physician, and Jake Summerford, who is a urgent care physician associate and clinical operations regional VP. So we're going to talk a little bit about, getting to treatment early because it helps you get care. So somebody in my family actually did have the flu, and they were kind of procrastinating, like, oh no, I'm going to go tomorrow. I'm not going to go today. And I said, no, go now, because that really will help you if you do have the flu. The person did in fact have the flu, and they were able to get the medicine, and they got better much faster. So I was glad to be able to offer that information. And so we're going to talk about that a little bit today. So I'm going to start with Dr. Burch. Let me get her popped up here. Dr. Burch, happy Friday.
Happy Friday.
All right, Dr. Burch. So why is it important for patients to seek care quickly when they're feeling sick, especially during the flu season?
Well, so what you said is true that influenza is hitting us really hard right now. South Carolina, statewide, is one of the hardest hit states currently. And we're seeing a lot of increased numbers. And with that, you also have increased hospitalizations associated with the influenza virus. And so we end up liking to get you diagnosed and coming in and looking potentially for treatment, especially if you are in a increased risk category for bad outcomes with the flu, to go ahead and get that treatment. The sooner you treat influenza, the better off the outcomes are going to be as far as decreased symptoms, decreased duration of symptoms, but also hopefully trying to help that person not have secondary complications associated with the flu. Influenza is a little bit different because it is a virus. And so with viral infections, we have to treat those sooner rather than later. And so there is a good 48-hour window from symptom onset to starting antiviral medications, where it shows that there is a difference in outcomes. And so that's why we recommend going ahead and getting the diagnosis of influenza, especially in those patients who are at increased risk for poor outcomes with influenza.
All right, Dr. Burch. So many illnesses like overlap. Like, is it the flu? And then I found a friend the other day, she actually had COVID, and then there's all these things that overlap. So what should people be thinking about? Is that another reason to go to care early, or should they be thinking it's one and when it's not the other? What would your advice on that be?
Yeah, I mean, it's always good to know what virus is infecting you, right? Because they have different potential outcomes, right? So like we talked about, if you have the flu, we can try to start you on antiviral medications. Unfortunately, the COVID, there are antiviral medications that you could take as well, more so in the adult population than the pediatric population. But again, that short window is very important to go ahead and get the diagnosis and being able to start on those medications sooner rather than later. I think it's also important to know, just from a clinician, what type of virus the person has, because it helps us if you do have complications with the flu or with COVID to know what that underlying diagnosis is, because it can help the clinician think about different infections that the person can get.
Yeah,
And
we know that.
those infections would be like secondary bacterial infections and having to do with what organisms you could be infected with.
Good. I'm gonna go to Jake right now. Hold on. Let's see. All right, Jake. So somebody is at home. They're thinking they might have one of the things that Dr. Burch just talked about. Can you walk them through kind of the process at the Prisma Health Urgent Care, like what would happen so that we would try to get them to diagnosis and treatment as soon as we could?
Absolutely. Yeah. Dr. Burch hit the nail on the head. Really and truly, it's the early intervention that matters most when it comes to viral infections, and preventing complications with it and can shorten the duration of it. Here at Prisma Health Urgent Care, we are available 7 days a week, 365 days a year. And one of the tools that we have at our disposal is a test called Spotfire that allows us to test for multiple different types of infections, including COVID, flu, RSV, and strep with just a single swab. And it's a very quick test that can happen within 10 to 15 minutes. We'll have the results out, and then we can properly assess the patient and give the right treatment plan for them.
We like that. I noticed the other day too, when we were taking my family member, that they were able to look online and see which, urgent care had availability and how quickly they can get in. Can you tell me about that for a minute? Yeah.
Yeah, absolutely. We accept walk-in patients, but patients are available to book online as well too, and to save a spot essentially. And they can do so at prismahealthurgentcare.org.
Good deal. So I'm going to go back to Dr. Burch. Hold on. Dr. Burch, one of the questions is how effective are the antivirals?
I'm sorry, say that again.
How effective are the antivirals? How well do they work?
So the antivirals that are available can be effective in shortening the duration of symptoms and also to decrease the type of symptoms or the amount of symptoms that you can get. And so they can have some side effects. Usually in kids, those side effects can be nausea and vomiting. The big one is Tamiflu or oseltamivir that we talk about. And so typically in pediatric patients, we reserve only treating those individuals that are at increased risk for bad outcomes with influenza. Being an adult is totally different because you have other options, and they are decently effective to decrease the number of symptoms that you have and the duration of symptoms. But the key is making sure that you get treated within that 48-hour window. That is where they are most effective. After that, they are much less effective at shortening the duration of the symptoms.
Okay, so we have a question from a media person asking the question, have we seen a lot of patients being hospitalized, and is there any concern about a surge or a bed shortage?
Yeah, we are absolutely seeing an increased number in hospitalizations due to influenza, and that's both in the pediatric side and the adult side. We are full. It is busy right now, and that's across the state of South Carolina. That's just not in the upstate or the Midlands. That is also in the PD regions and the low country regions. So it is, the flu is out there and people are getting sick enough to be hospitalized.
Is it too late to get your flu vaccine?
Absolutely not. So the best way that you can help protect yourself from getting the flu and or getting bad complications from the flu is to get your flu shot. Okay. Now, I would encourage anyone who has not already gotten their flu shot to go ahead and get it, because remember, it takes your immune system 2 weeks to start making antibodies towards that vaccine. So time is of the essence because we are at peak flu season currently. But it is important, even if you wait a little bit, to go ahead and get the flu shot, because there are different serotypes of influenza that circulate around. So just because we're having a peak of influenza A currently does not mean that we're not going to have a surge of influenza B later on in the season. And that particular flu shot protects you against all, several serotypes of the flu that we see circulating around. The really key this year, though, about getting the flu shot, it might not protect you from getting influenza, but what it can do is help you from not getting hospitalized from influenza, from not getting put in the intensive care unit from influenza, and unfortunately, maybe not dying from influenza and complications that are associated with influenza.
Okay, so this is I'm not sure you can answer this, Dr. Burch, and then I'll go back to take. It says DPH's last flu watch reported a decrease in test and ILI levels. What could be causing, I'm glad you know what that is because I don't. What could be causing that downturn trend? And could it correlate with less traveling or gathering post holidays, quick action vaccination question mark? Yeah.
Yeah. So I'm not sure. So it just shows downtrend. I mean, sometimes that just shows that have hit the peak and that, we're getting a little bit better as far as the ILI illnesses are concerned. ILI means influenza-like illness. So cough, cold, fevers, those kind of things, that what we're talking about that makes you go to urgent care to get that flu test, to get that COVID test, to get that RSV test, those kind of things.
Okay, I'm going to go back to break. All right, Jake. So Dr. Burch mentioned children. So I just had a question about, does the urgent care test children for flu and all of those things too?
Absolutely. We see all age groups.
Well, that's good to know because I think that'd be a quick way to find out whether you have it or not. I also have a question, and I'm going to start with you, Jake, and I may need to go back to Dr. Burch on this if you guys know. Are the antiviral medications readily available?
As far as I'm aware, I've not heard of any sort of inventory concerns when it comes to that. I don't want to speak for Dr. Burch, but after speaking with some of our clinicians as well, we've not had any issues getting the antivirals at this point.
Right. So when you come into urgent care, does it give you an estimated like how much time you'll spend there? We don't do that, do we?
Our front desk individuals, or I'm sorry, our individuals working the front desk can help provide that information at that time. Absolutely.
Okay, so I know that people are managing their time. They always
Absolutely.
like managing time. So I will say the other day when I had to go with a family member, we did look at all the ones online and then looked at the one that didn't have weights, and we went to that one.
Of
So
course.
that was really helpful. All right, Dr. Burch.
Absolutely.
Let's see. Dr. Burch, so I was just following up on the antiviral question. Have you heard anything about any antiviral availability questions? I mean, availability at all?
No, I haven't heard anything from any of the providers in the area that typically will ask me questions about not being able to get antivirals for influenza.
And I think you addressed this, but I wanted to go back to it. The question was, do you see a certain age group being impacted, and are children a large part of that target group?
Yeah, I mean, absolutely. Pediatric patients get the flu. And typically, when you look at pediatric patients, the ones that are highest risk for getting to things like hospitalization for the flu or secondary complications are very young pediatric patients, so kids less than 2 years of age, and or those individuals who have increased chance of getting bad outcomes with flu. And so those are people who have respiratory disease like asthma or cystic fibrosis or heart disease, or might be immunocompromised, those kids who are chronic patients that get medicines and go and see the doctors frequently, those kind of things. Those are the ones that are highest risk for bad outcomes with influenza. Your typical 6-year-old kid who, has a good immune system traditionally does pretty well with influenza. However, that does not mean that they might not get secondary infections associated with flu. This particular year is a pretty aggressive influenza strain. And I think that that's why we're seeing a lot of surge in numbers of people getting the flu. There's a couple of different reasons for that, but uh, I don't want to put false hope into parents who have a normal child with a normal immune system thinking that they are not going to get any bad outcomes from the flu, because we're absolutely seeing kids who are hospitalized who do have a normal immune system and don't really have any comorbidities. So the key here, though, is those kids, the majority of them who are being hospitalized, have not been vaccinated against the flu.
All right. So this question is about the symptoms difference between symptoms. Are flu A symptoms different from typical flu experienced in South Carolina? And once you know you have flu A, is treatment any different?
Yeah, so there is no difference in treatment with whatever serotype, for the most part, that you have with influenza, whether it be type A, H1N1 versus H3N2 versus serotype B influenza. It is pretty much all the same, and most of the time the symptoms are similar across the serotypes as well.
Good deal. I'm going to go to Jake. Okay, so Jake, so here's the question. So if you already had the flu, should people be still getting their flu vaccine anyway? And maybe that's a question for Burch. I'll start with you though.
Yeah, absolutely. You can get the flu more than once. And as Dr. Burch has mentioned, there's different types of flu as well too. And so you can most certainly get the flu more than once. If you're that unlucky individual, you can do it more than once in the same season as well too. And so, yes, to answer your question, I certainly do encourage those who have not gotten the vaccine to be vaccinated, even this time of year.
What can people do to help themselves? And I'll ask Dr. Burch this too. What can people do to help themselves get better and recover more quickly?
As with any sort of infection and any sort of viral illness in particular, such as the flu, which is highly contagious, if you're ill, the best thing to do is to stay at home. And there are other measures that you can take, such as hydration, rest, and then in addition to some medications over the counter or prescriptive that you can take as well.
Good deal. I don't think we have any more questions, but I just want to give you, Jacob, a final opportunity to say anything else that you wanted to say about this topic and make sure our community knows how they can get help.
Yeah, no, I certainly appreciate the opportunity. That's for sure. We've kind of talked about this a little bit. I know Dr. Burch definitely hit on it. And again, she hit the nail on the head. Timing is everything when it comes to these sorts of illnesses. And so if you're unsure of whether your symptoms need to be checked out, it's always better to be evaluated sooner rather than later. And again, Prisma Health Urgent Care, we're here 365 days a year, 7 days a week. We have virtual options to be seen as well as in person as well. And all of those are available on our website at prismahealthurgentcare.org.
Oh, wait, I forgot about the virtual care. So you can also get virtual care, which we know that it's been a big thing lately.
Absolutely. Absolutely. As you alluded to earlier, everyone's time is important. And we recognize that as well too. And so not only are we able to provide fast, efficient care within our centers, we also have the opportunity to do virtual visits as well.
Good deal. I'm going to go back to Dr. Burch. All right, Dr. Burch. So, I'm giving you a chance to make your final thoughts.
Yeah, so I think it's important for everyone to know that flu is real this year. It's real every year, but this year we are definitely seeing an increased surge in cases, numbers, hospitalizations associated with influenza. The best way that you can protect yourself and your family is getting vaccinated. I encourage everyone who has not already gotten their flu vaccine to go ahead and get that. Again, it might not stop you from getting the flu, but what it can do for you is stop you from getting hospitalized because of the flu or getting higher care in the hospital from the flu, like the intensive care unit, getting intubated, and God forbid, potentially dying, which we have seen deaths this year associated with the flu. The other thing that I would like to stress is good hand hygiene, making sure you have good cough etiquette, and staying home if you are ill. It is so easy for parents to go ahead and give Tylenol to a kid who might not be feeling well and sending them to school. And I get that because you have to get to work because they can only miss so many days. But honestly, if your child has a fever, if they are too ill to participate in school, please keep them home, because not only will it help your child, but it also will help not spread those germs to other kids who are there.
What about adults, Dr. Burch? Don't they need to stay home too?
Yes, absolutely. Adults need to stay home too if you're ill. Don't go to work. I know that you have to go to work to make a living, but honestly, if you are ill, truly, if you have fever, those kind of things, don't go to work. Make sure that you take good care of yourself.
Thank you, Dr. Burch. All right, team. Thank y'all so much. We are so thankful for Jake Summerford and Dr. Anna-Kathryn Burch for bringing on some information and reminding us to be good citizens. And Prisma Health is always here to help. So if there's something else we can do to help out, just let us know. And if you need some help, need to go to urgent care. I'm sure they'll be there all the time waiting to help you out. So thank y'all. If you need anything else, please let me, Sandy Dees, or Rebecca Munnery know, and we'll get you straightened out. And everybody have a happy Friday. Bye, y'all.
Thanks.
Thanks.